All right, today we're jumping into a topic that can cause a lot of stress for new parents: how to care for your baby boy's foreskin. Look, if you've been worried about this, you are definitely not alone. In the next few minutes, we're going to give you some really clear, simple guidance. So let's get right into it.
You know, it's a question that can really send your mind racing. You look at your baby boy, you notice his foreskin doesn't pull back, and that worry starts to creep in, right? Is something wrong? Let's just be super clear. This is one of the most common concerns for parents of little boys.
Okay, first things first, let's just take a deep breath. What you're probably seeing is a completely normal part of your baby's development. Let's break down what's actually going on here.
The main thing to get your head around is that for most baby boys, the foreskin is supposed to be attached at birth. It isn't meant to pull back right away. It's just a natural process where it separates all on its own over time. This usually happens by age 4 or 5, and it's almost always fully retractable by the time puberty hits.
Now, when a foreskin stays too tight to be pulled back as a child gets a bit older, you might hear a medical term for it: phimosis. We're just bringing up this word so you know what it means if you ever have a chat with a doctor about it. Don't let the word scare you.
So, how do you know what's just normal development and what might be something to keep an eye on? Well, there's actually a really gentle way you can check for yourself at home.
Okay, here's the simple check. When you very gently try to pull the skin back, does it move a little bit, maybe about a centimeter? That's a great sign. That's normal. But if it doesn't move at all, and all you can see is this tiny little opening, that's what we're looking out for as a potential sign of phimosis. The key here is that a little bit of movement is good, no movement at all is the thing to watch. So why is this even a thing we need to think about? Well, if that opening is really tight, it can sometimes make it a bit tough for your little one to pee freely. Urine might get a little trapped, which could cause some discomfort, and if it's left unaddressed for a long time, it could lead to other issues down the road.
Now for the good news. For many kids, there's a super simple and gentle massage technique you can use right at home to help the process along naturally. Let's walk through exactly how to do it the right way.
Okay, let's break this down step by step because it's really important to get this right. First step, and this is a big one, don't even think about starting this until your child is at least 2 years old. When you do, use just a little bit of oil on your hands. Then, and I mean ever so gently, pull the skin down just as far as it will go without any force or discomfort at all. Doing this a couple of times a day, maybe during bath time or a regular massage, is perfect.
The whole point here is not to force anything. Think of it this way. The foreskin is often just naturally stuck to the head of the penis. This gentle, repeated motion just encourages that skin to separate on its own, little by little, over time. The most important thing here is patience.
All right, we've talked about what to do. Now let's talk about what not to do. And honestly, this next part is maybe even more important. I really can't say this enough. Never, ever use force. Don't try to fix it all in one go with a sudden, sharp pull. That area is incredibly sensitive, and being aggressive is going to do way more harm than good. Please, ignore any outdated advice you might hear about using forceful methods.
You know, the source material we're looking at makes a really important point about this. Back in the day, there was this old practice where some midwives would just pull forcefully. We know now that is absolutely the wrong thing to do at home. Medical understanding has changed, and the modern approach is always about being gentle.
And here's exactly why that warning is so serious. Forcing it can cause real pain for your child. We're talking swelling, little tears, and even bleeding. That can create scar tissue, which, believe it or not, can make the problem even worse in the long run.
So what if you're doing the gentle massage and it just doesn't seem to be making a difference? Or maybe you're just feeling a bit anxious about the whole thing. That's your cue to call in the professionals.
Okay, here's a little checklist for when it's time to call the doctor. If you've been trying the massage for a while and you're just not seeing any improvement, or if the skin looks really tight, and this is the big one, if your child seems to be in pain or is having any trouble peeing, pick up the phone. And hey, even if you're just worried, trust your gut. There's no harm in getting a doctor's opinion for peace of mind.
A doctor can take a proper look and really figure out what's going on. They'll be able to tell you if it's something that's likely to sort itself out on its own or if it might need a little help. Then they can walk you through all the different options, which could range from things like special creams to, in some cases, a procedure like circumcision.
So, let's bring it all together. For the vast majority of boys, this is just a normal part of growing up. Your most powerful tools are simply understanding the process, using gentle techniques, and knowing when it's time to ask for help. With the right info and a little bit of patience, you've got this.